Welcome to Talk, Test, Thrive. This video is about making every contact count when it comes to talking about HIV confidently. Every year we campaign as part of the National HIV Testing Week to raise awareness and encourage people across Suffolk to test and know their status. As workers in the community, you may not deliver sexual health services directly, but you are often a trusted point of contact. Small everyday conversations can make a real difference in reducing stigma, encouraging testing and supporting prevention. This training will focus on 3 key areas: HIV testing, challenging stigma and HIV prevention. So, you may be thinking, what does making every contact mean in the context of sexual health? Making every contact count means using appropriate moments to normalise conversations around HIV, share accurate, up-to-date information, also reduce fear and stigma, and to signpost to appropriate support services. Remember, you don't need to be an expert, just be open to having the conversation, be informed and confident with signposting. HIV testing is crucial in saving lives and preventing new transmissions. This is a quote directly from the Department of Health and Social Care in the newly released HIV Action Plan for England, which aims to end new transmissions of HIV by 2030. A link to this plan can be found in the description below. When it comes to promotion of testing, there are some key messages to reinforce. HIV testing is quick, confidential and free. Many people test routinely as part of looking after their sexual health. Testing sooner means treatment can start early. People on effective treatment cannot pass it on, and that's fact. So, what does this look like in practice? A make every contact count moment may arise if someone you support is discussing their sexual health worries, someone is talking about a new relationship they have entered or that they are currently dating, discussing testing for other conditions. A simple non-judgmental response could be:
lots of people test as part of their routine health checks. There are confidential services if you ever want information.
Next up, challenging HIV stigma. Stigma remains one of the biggest barriers to testing and prevention. HIV stigma can look like fear of being judged, outdated beliefs about who can contract HIV, avoiding testing or services, language that links HIV with shame, blame and outdated myths. Let's look at what we can do in the community. Challenge outdated language. For example, we now use the term late stage or advanced HIV rather than AIDS, as this carries a lot of stigma. Avoiding assumptions about behaviours or identity, reassuring that HIV can affect anyone regardless of sexuality or gender. Reminding that HIV is a manageable health condition and people living with HIV will most likely die of an age-related illness. Let's look at this in practice. Someone says to you, HIV is a death sentence. How could you respond?
HIV treatment has improved and become more manageable. People can live long, healthy lives and effective treatment means it can't be passed on.
Now on to HIV prevention. There are now a range of preventative measures to stop the onward transmission of HIV. Condoms reduce the risk of HIV and other STIs. Regular testing means you're in control. PrEP is medication that can prevent HIV transmission and is free to access through sexual health services. PEP is an emergency medication available after potential exposure, which must be taken as soon as possible and no later than 72 hours post-exposure. This is available free at any A&E department and sexual health clinics. This is about giving people choices to decide what will work best for them. If someone isn't sure of options available to protect themselves, here's how you could respond.
There are prevention tools available. Shall we look on the Suffolk Sexual Health website to know what's best for you?
Reminder, you don't need to know or be able to explain everything. Simply knowing these options can help people find what's best for them. Lastly, being confident to signpost is crucial to ensure people are able to access the correct services. Here are some tips with signposting. Be clear and don't overwhelm the person. Think about the individual. Someone may not want to take physical leaflets due to individual circumstances. Keep it appropriate. Emphasise confidentiality and choice. Signposting to sexual health services can be as simple as:
there are confidential clinics and online services where you can get testing advice. I can help you find one.
It's good to be proactive. However, respect professional boundaries. If someone is not open to a conversation, then don't feel like you should push it. Be led by the individual and the natural flow of conversation. Ensure you are following your organisation's safeguarding policy. Remember, you are opening a door to a conversation, not asking for disclosure of HIV status. As we come to the end of our video, let's revisit some key points. Make every contact count means recognising that everyday interactions can support healthier, safer choices. By normalising HIV conversations, challenging stigma and signposting, you can play a vital role in improving outcomes for individuals and communities. If today's video has inspired you to learn more in regards to HIV, tools against transmission such as PrEP or PEP, or sexual health services in Suffolk, we offer free training to Suffolk professionals. Please have a look at our Eventbrite page to find out what we are offering. We can also deliver free trainings in-house to your organisation. One final reminder to check out our website for handy resources for professionals and the people that you support. Please email us at provide.sshsoutreach.nhs.net to find out more about our training and outreach services in Suffolk. Thank you for taking the time to watch today's video. We hope it has equipped you with some practical information to utilise the moment, to make every contact count and to have confident conversations around HIV. Thank you for the work you do. A short feedback form for today's video is linked in the description. Please complete and let us know if you found today's video useful in increasing your confidence to speak about HIV and sexual health services.